So hello and welcome to the Michigan Works Association 2021 Annual Conference. My name is Marty Scarborough and I'm a business services representative with Northwest Michigan Works. On behalf of the staff at the association and all of our sponsors, we thank you so much for being part of the conference and this session titled Great Resignation Panel Discussion. Please be sure to visit the exhibitor booths during the designated exhibit hall times. A big shout out of thanks to Oakland County, Michigan Works for sponsoring today's workshop session. Our sponsors help make this conference happen, and we are very thankful for their support. Along with our sponsors, our exhibitors who have also given their time to be part of our event. Please be sure to visit the exhibitor booths during the designated exhibit hall times. Before I begin today's session, there's a few housekeeping items I'd like to share with you. Please make sure your audio is muted. This session will not have a Q&A, but if you happen to have a question, you can enter it in the chat area, and if there's time, the presenters will try to answer it. We are eager for your feedback about the conference and the session, so please take a moment to complete the short survey that is in the chat. Presentations will be available post-conference on the Michigan Works Association website. And now I'd like to introduce your panelists for this session. Your moderator will be Dave Coulter from Oakland County. Our panelists are Justin Winslow, President and CEO of the Michigan Restaurant and Lodging Association, Nancy McKeague, Chief Operations Officer with the Michigan Health and Hospital Association, David Worthams, Director of Human Resource Policy, Michigan Manufacturers Association. Dave, take it away.
Well, Marty, thank you very much. And thank you, everybody, for jumping on this panel. I'm really excited. We have a really talented group of people, and I think you're going to learn a lot this morning. So I'm Dave Coulter. I'm the Oakland County Executive and a big fan of Michigan Works, by the way. And I want to welcome you to this panel, which we have called the Great Resignation. This panel discussion is being recorded, by the way, and will be made available for those who are not able to attend. So before we get into the questions, like I said, we have a very talented group of panelists today, and I want to give you just a brief bio on each one of them so you understand who we're talking with this morning. First, Nancy McKee. As Marty said, she's from the Michigan Health and Hospital Association. She's been there since 2004, but she's its Chief Operating Officer. She's been in that role since 2019. She has, it says how many years here, but Nancy, I'm just going to say many years of experience in government relations and nonprofit association management. She specializes in labor, insurance, employment law, employee benefits, organizational development, and she's active in legislative and regulatory issues at both the state and the federal levels, and she frequently testifies as a subject matter expert. So she holds dual national certification as a senior certified professional from the Society for Human Resource Management and from the Human Resource Certification Institute. And she's also an active member of the Society for Human Resource Management and its National Advocacy Network. She earned her bachelor's degree from in business administration, from Spring Arbor University, and a master's degree in administration and a concentration in HR from Central Michigan University. And finally, she serves on the board of directors and the executive committee for Sparrow Health System in Lansing, where she also chairs the Human Resource and Compensation Committee. Justin Winslow, really happy to have Justin here with us this morning. Justin became the president and CEO of the Michigan Restaurant and Lodging Association in 2015 after having served for 4 years as the vice president of government affairs for the association. He's responsible for expanding the scope of the association through the incorporation of both statewide lodging association and the Detroit Restaurant Association into the MRLA. He also led statewide coalitions that successfully defended the industry against ballot proposals during his tenure. He earned his Bachelor of Arts degree from James Madison College at Michigan State and his Master's of Public Policy and Administration also from Michigan State. And then finally, we have Dave Worthams. He is the Director of Human Resource Policy for the Michigan Manufacturing Association. In this role, he leads the organization's efforts with the legislature and state agencies on things like workers' comp, unemployment insurance, education and workforce development, workforce safety, healthcare benefits, and labor relations. Before that, he served 10 years at the Michigan Bankers Association, most recently as the VP of Public Policy. And before that, he was with the Michigan Municipal League. So lots of experience. And he adds exceptional legislative and policy experience to the MMA team as a former Kalamazoo County Road Commission. So there's an interesting political dynamic for you. So we are, as you can see, I think we're very fortunate to have three very experienced people in this field. I think it's going to be a great conversation. So let me just kick this off. We did entitle this The Great Resignation. So since the pandemic, as you all know, employees are leaving the workforce kind of in droves. In the U.S. alone, April saw more than 4 million people leave their jobs, according to at least a summary from the Department of Labor. That's the biggest spike on record. Now, there's a variety of reasons people are seeking a change. And some economists, like I said, have dubbed this the Great Resignation. So we want to talk more about what that really means and how it affects the work that we do. For some workers, the pandemic precipitated, I guess, a shift in priorities, maybe encouraging them to go to a dream job, or maybe transition to be a stay-at-home parent, right? But for many others, the decision to leave came as a result of the way their employer treated them during the pandemic. The industries most impacted by this Great Resignation included retail, hospitality, manufacturing, technology, and healthcare. And so that's why I think our panel is really appropriate today. So let's get started with Justin, my Spartan colleague, who is the president and CEO of the Michigan Restaurant and Lodging Association. We'll start with them because Justin, what I'm told is that more than 740,000 workers who quit or were laid off worked in the leisure and hospitality industries. So from your perspective, why do you think this industry was hit so hard? And maybe more importantly, how do you think your members can recover?
Yeah, it's a great question. And good morning, Dave. Great to be with you. Go Green. And what a great panel. Dave Worthams has probably already forgotten more than I'm ever going to know in terms of public policy around this town. And everyone in this town knows that Nancy's a legend, and it's known every time we see her walking around town. So I'm honored just to be a part of it. So thank you for having me. This industry has taken it on the chin a little bit harder, I think, than any other industry. And we can certainly have that conversation during this next hour, but felt the pandemic the most severely first, and is still feeling it today with the level of uncertainty in the environment. So at one point in April 2020, about 80% of restaurant and hotel workers were laid off or completely, or at least furloughed at the time. And the industry has bounced back to a degree, but there's no single answer. I think that there's the perception that this industry is a monolith and that one single thing can define what's happened to this industry. And if we fix that one thing, we will have solved the problem for why hospitality is struggling. And at times, I think we have been the political football on both sides of the aisle. And so, there's some truth in each one of these things, but the assumption that that is specifically a wage or a pay issue for this industry, and if this industry simply paid more, magically everyone would come back and that would work. And I think to some degree, and for some people, that has been a realization, and they found other work than this industry. It's not a leading factor. In fact, this industry has been raising wages faster than the economy since 2017, because it has to. That's the market-driven forces. And in 2021, we've risen wages by double digit, and we're usually doubling the second highest industry at the rate by which we're increasing wages. And again, as a complete function of the market, just to try to get people back into and working in this industry. So it's a component, but it's not the only component. I think you go to the other side of the aisle, and then clearly it was just supplemental unemployment benefits where we're keeping everyone at home. Everyone's lazy and at home, and they don't want to work. And therefore, once we get rid of those, everyone will come flooding back and all our problems will be solved. And I don't think it's that easy either. I think on the lower end of the spectrum, a lot of the intro level work in this industry, we were competing against the federal government and the type of benefits that were offered. But again, that's not a driving force either. I think it was a component that drove a percentage of people that could otherwise be working in this industry to not. And I think we're starting to see that change a little bit with the expiration earlier this month of those benefits. But again, that's not a driving force either. I think the instability, the uncertainty around COVID and how that affects this very, very public facing industry. Hospitality by nature is in person. It is with you. It's there to put a smile on your face and make your day a little bit better. And when you're closed for 159 days for indoor dining, people don't feel like they have necessarily a stable chance come back to that industry. They found other work that maybe started off temporarily, but is now a new career change. When you're in limited occupancy for over 400 days, if you were, let's say, a server who was making great money, and some of these people making six-figure salaries at high-end restaurants where it's all about the experience, when you're at limited occupancy and you have a clientele that feels particularly concerned about going back out in public, you as a tipped employee that was making great money before aren't making great money in this environment. And so you found other opportunities, you found other work and left. And so those all played in the environment as well. And I think there's a segment of this workforce, especially those who have been in a longer period of time, where these straight up safety concerns of, do I feel comfortable being in person, communicating with people all day long, has been an issue, especially when we've had a more hostile environment, frankly, in work, when you're in public facing industries like restaurants and hotels, and some segments of the population have been very hostile to those in the workforce. It really isn't their fault that you have to wear a mask, but sometimes that they were the ones who bore the brunt of it. I think some people said enough. And that led some people away as well. So, what do we need? How do we come back? How do we get this industry back to where it was, or maybe better? I don't think it's going to be exactly the way that it was. I think we've seen some transformational change where the new normal will not look just like the old normal. So first and foremost, though, we do need a stable environment, right? Like, as long as COVID, whether it's Delta or any other variant, is the top news story and driving decision-making, and there's a feeling of uncertainty out there, whether people should go out and travel, should go out and have a great dinner out, that's going to limit a portion of the population from wanting to come back, and that's going to limit the industry. So listen, there's a huge debate already within this association, within this industry, about what President Biden did last week is a good thing or a bad thing. There's certainly some questionable constitutionality of what he did, but the intent of which to create a stable environment through vaccination, wherever you are on the political spectrum, is something that will create a more stable environment, and something that we take pretty seriously, because I don't think this industry gets back to where it needs to be until we just are past COVID being a flare up and a drop, to the point where people feel scared to come back out.
So Justin, if I may follow up on a point that you just made, because the industry is going to change to some degree. Yeah. And even though folks have folks in the restaurant industry in particular have the option of being open now, one of the things I've seen a lot in Oakland County, and I live in Ferndale, we have a lot of great restaurants there. We have a lot of great restaurants throughout Oakland County. But I'm seeing a lot of instances where restaurants have cut back their hours or their days of operation because of these staffing shortages. And I'm just wondering, that feels like a short-term solution. How long do you think that's sustainable, and where do you see that going?
Yeah, it's a really good question. I mean, we pulled this in August and found that about 9 out of 10 restaurants and hotels, really essentially every hotel, but about 9 in 10 overall, the hospitality industry were shrinking days or holding back rooms because they just didn't have the staff to fill them. I think we're moving past, now we're post Labor Day, some of that summer surge is going to fall off. Some of the people who felt comfortable dining out might not feel comfortable dining in as the season changes. And so this industry is going to have a chance to sort of course correct, because the demand is going to shrink and get itself right over that period. But the workforce is just burnt out. That's why you see people closing on a Sunday and a Monday, sometimes beyond that, because they just didn't want to burn out those people who were still willing to come back and drive through. We were talking to someone the other day who had literally worked 69 straight days at a Burger King without a day off. They were the manager doing every job you can possibly manage because they just didn't have the staff to fill the rest of the opportunities. So, the industry is adapting to more off-premise, because that's going to be part of its transformational future. 55% pre-pandemic is what was off-premise. Now it's 80%. 80% of restaurant sales are off-premise. Hopefully it won't stay that high, because restaurant experiences are something I think we all take for granted and want to be part of our life. But that's a big change. And we need to do a better job as an industry of educating, training, and creating a culture that people want to stay in the industry, making it clear to them that they have a ladder of opportunity.
Thank you. I think we can all agree working 69 straight days is not the ideal way to get out, not sustainable. So let me go to Nancy, because Nancy, healthcare may be one of the hardest hit industries by the pandemic. Again, the Labor Department said that healthcare workers and educators have been leaving their jobs at the highest rates since 2002. So COVID continues to spread. Delta is spreading. The pressure put on the healthcare system just continues to grow, right? The workers have grown tired and frustrated, much like in other industries, after a year and a half of having to deal with all of this. What do you see as the long-term impact of the pandemic on the healthcare industry? And maybe related to that, what are the providers doing to address the workers' concerns and challenges? And you're on mute, Nancy. We appreciate. Yep, there you go. Yeah, if you just unmute yourself. Yeah.
All right.
Thanks,
Rookie mistake. It has been a really difficult time for healthcare workers across all of the spectrum in our hospitals. So everything from food and nutrition to housekeeping to patient transport to our frontline caregivers. It's been a really, really difficult 18 months. I do have to give a shout out to Justin's members. The restaurant industry really has been terrific throughout the pandemic in providing meals and support to our hospital staff when so few places were open, especially during the first 3 surges. And so that sort of community support has really been terrific. But as the pandemic has lingered on, we are seeing a significant amount of burnout in our employees. Right now, we know from a poll in April from the Kaiser Family Foundation that 62% of our healthcare workers said stress related to COVID has had an adverse impact on their mental health. 55% of them say that they're burned out, and almost 3 in 10 of them say that they're considering a different career. So within the hospital, we're trying to do a variety of different things. One is in the areas where we compete with the rest of the business community for jobs. So our cafeteria workers, for instance, transport workers, front-facing clerical workers, we're increasing wages, we're changing scheduling, we're being more flexible, we're assisting with daycare and elder care to try to get people back to work. These employees are just as adversely impacted by school closures and daycare closures as anybody else is, which has made it difficult for them to return to work as well. And then among our frontline healthcare workers, I can't overstate how tough this 18 months has been on them, because their whole way of providing care to patients and their families has been turned upside down. And they've been sitting by the bedside of people who are dying and aren't able to have members of their family with them. And they're used to being able to heal people and comfort their families and send people home with a sense of hope and a positive outlook. And that's been taken away from them. And at the same time, they feel that they're putting their own health and their family's health in jeopardy in order to provide these services. And we, talked a little bit about the public pushback about masks. We're seeing the same thing in the hospital with increasing incidents of violence against our caregivers, a lot of verbal and emotional abuse of caregivers when the families don't like what they're being told or are required to follow the rules. And unfortunately, it's our nursing staff that's on the front line and having to respond to all of those things. So, you've read all of the coverage the last few days. We've seen hospitals now having to reduce the number of beds we have open in order to take care of emergency cases and COVID cases and make sure we can concentrate staff where we need to. That means that we've had, in some cases, to postpone elective surgeries, which aren't surgeries you don't need to have. They just mean they don't have to happen today. So there's been a delay for some people in receiving care as a result of all this. But for me, talking to these frontline caregivers, it's the emotional burnout that has been the most significant. So pay is always important, We're trying to do what we can to be as competitive as possible. We're competing with agency nurses right now. A lot of nurses have found it easier to go to work for a traveling agency because they can distance themselves a little bit from the hospital where they used to work and the patients that they were assigned to every day. And they can choose their own schedules and they can leave when they want to without feeling disloyal to other caregivers who are on the front line. So we're trying to address those scheduling concerns, trying to address pay competitiveness, working a lot on work-life balance. I have to give a shout out to our colleagues in organized labor. The Michigan Nurses Association has just done yeoman's work, working with their employees to try to work our way through all of these difficulties. But it's staggering to see the public hostility towards caregivers right now. They went from being heroes really early in the first couple of surges to now being the focal point for a lot of people's frustration. And when you don't feel recognized and rewarded at work, when it's the patients and families that you're taking care of, it's very, very hard for us to overcome that in other areas. So I think we're looking at a decade of disruption coming out of the pandemic, where we have to rebuild this workforce and take a closer look at scheduling and more family-friendly hours. And that may change patient expectations about how rapidly they can get care and how they access it. And telemedicine's definitely here to stay as a way of dealing with all of that.
Well said, Nancy, and thank you for that. And as if as if things in the hospitality and the healthcare field haven't been disruptive enough, manufacturing has been disrupted as well. And so, David, I want to ask you the next question. One of the biggest impacts I guess we're seeing on the manufacturing in Michigan right now is the shortage of computer chips. We've all read about that, causing temporary layoffs, at least in auto plants across the state and the nation, frankly. But from your perspective, sort of what other supply chain disruptions have you seen affecting manufacturing in Michigan? And maybe to this point that Nancy talked about, a decade to recover, which is just amazing to me. How long do you think it's going to take companies to recover from this sort of supply chain issue that we see all across the state?
Well, Dave, thank you for the question, and let me kind of echo something that Justin said. I am honored to be amongst some great leaders on this panel, and as the lowly Mac School representative, although Nancy got her master's from Central, go Broncos. I definitely want to appreciate everything that's been said so far. There are some serious supply chain issues. A lot of folks want to talk about computer chips and the fact that you go to a car dealership and you're seeing half empty lots or completely empty lots, and it makes it very challenging to try to figure out what's going to be the impact on the economy. How are we going to recover from this? And as you look beyond just the computer chips supply issue, you then recognize that it's even more than that. You've got cargo containers that are in short supply right now. Not necessarily in short supply, but just they're on the other side of the ocean because we can't get them over here. And that was a problem even before we had a ship get crossways in the Suez Canal. You've got some slowdowns down at the Panama Canal as well. And so as we have these backup of shipping containers and shipping needs, it really stresses the entire supply chain, not just computer chips, but then you're talking metal, you're talking steel. On the other side of some of our manufacturing folks, you've got shortage in wood pulp. So now we don't have folks who are making paper which then leads to we got Christmas wrapping paper problems that could be somewhere down the road at the same time. And it is something that has continued to pile up upon itself. In answer to the question of how long do we expect the computer chip shortage to last, some folks will say it should last another year. I've talked to some folks in Europe who say they expect it to last another 3.5 years. and hopefully we will get some support from our friends in the federal government and the state government. Maybe we can find somebody here in the United States who can open up a computer chip factory to try to address that. When you talk about the shipping containers, you're probably looking at another 2 years in that as well. So it's definitely something that is going to be a large challenge. And then as people are waiting for these products to be made, and as folks are looking for how do we ship a product from the East Coast to the West Coast or vice versa, then we start looking at labor shortages as well. There's a shortage of truck drivers right now. Whether it's owner operated, whether it's corporate, what have you, these are all kind of piling upon one another and really stressing the supply side of the supply chain in ways that, frankly, we could not have imagined. And so, Nancy suggested that they're looking at a decade recovery coming from the pandemic. I tend to agree with that. By the time we sort out the computer chain to the shipping containers to other supply issues, it is a long recovery that we have ahead of us. Manufacturing has been lucky that we've been able to keep most of our folks employed during all this. There have been some temporary shutdowns, and we've had to adjust some public policy that here at the state to address that. But I think we've been lucky that because of the role manufacturing plays, particularly in this state, but throughout the nation, that public policy makers have been very understanding and very willing to do what it can to help get us through that. And so I think that is reflective of something that Justin touched upon, that there's not a magic bullet, one magic key, one spell that you're going to cast to get folks back to work. I think if I recall the numbers correctly, last week there were just over 575,000 people who were unemployed, and just over 500,000 of those were directly connected to federal benefits. So if you want to go with the logic that, all right, the federal benefits are gone, so those 500,000 people should go immediately back to work, that just doesn't happen. And so as we deal with the value of a job and the prestige of having a job, as we deal with some of the mental health needs that employees have, it is quite the puzzle that we're going to have to put together as we come through this decade recovery that we're about to experience.
Wow. So if you look at the timeline here, a very sobering assessment from all three of you that this is, I think to some degree, we let our guard down a little bit over the summer in terms of where we were with the pandemic, but it's clear even after the health portion of this is done, the economic impact of this is going to be with us for a long time. So I appreciate the insight of all of you. Let me do this now. I got some questions that I'd like to throw open to all of you. So, keep your answers to a couple minutes and we'll try to get to as many of these as possible. But this is for everybody. We've heard a lot lately about efforts to attract and retain talent in this tough environment. In the news the other day was Amazon, who said if you've worked there for 3 months, you get tuition reimbursement now, all kinds of different benefits and pay. But excuse me. But as you've correctly noted, it's not just about pay. It's about the work environment. It's about all sorts of things. So just talk a little bit about for the members that you represent, what are some of the things they're doing and maybe some of the more unique things they're doing to attract and retain talent? Nancy, why don't we start with you?
Thanks. One of the things we're doing is trying to remove the barriers that allow healthcare professionals to work to the top of their license so they can provide the care that's within the entirety of their scope of education and training. The other is to provide more reliable schedules so that they and their families know what to depend upon. And we're also instituting some pipeline workforce measures where we can do more training within the hospital so that people don't have to leave work to go to school, to take more time away from their family, but get more of the education and training on the ground. I think it's really incumbent on those of us who work in healthcare organizations to recognize that these employees are our partners in solving the problems that we have on a go-forward basis. And we really need to spend a lot more time talking to them about what we need to provide them with on the floor. Thanks, to the manufacturing industry, we were able to get a handle on the personal protective equipment problems pretty early on in the pandemic. So I'm much more comfortable in the safety and security of our employees than I was at the beginning of the pandemic. But it's time for us to recognize and be partners with physicians and nurses and phlebotomists and the people who work in our labs about what we can do now to provide them with mental health support, with family support, with predictable scheduling, with adequate reimbursement, and stability in their jobs, and restore their sense of self-value in the services that they're providing to people across the state. It's going to be a great partnership effort. And, fortunately, most people are very grateful for the work that our medical professionals are doing. And I don't want anybody to underestimate the value of a kind word to your own doctor or nurse or pharmacist during this time period, just like in the hospitality industry. Just having people recognize that those people who showed up are really making a valuable contribution, even if they're running double time to try to do the work that they did before.
If there's a key takeaway, by the way, everybody, tell your waiter or waitress, tell your nurse, tell your doctor, tell somebody you appreciate it. Man, it goes a long way, doesn't it? Thank you for saying that. Justin, how about in the hospitality field?
Click off. There we go. Nancy said it so well, right? There are limits on how much this industry can pay and still be able to stay solvent depending on where you are. And so to Nancy's point, not every restaurant is struggling. Some are doing magically well. And I always want to ask those that are fully staffed and have adequate teams and full restaurants, what are you doing? And it's just, it is a sense that their employees are part of the team, that they are involved in a culture that values them as individuals, takes care of them, some ways formally through pay and through benefits, in some ways informally when they need a little extra support. A car broke down, they're there to actually help, or sometimes child support comes into play and they are able to play a role in that process for that individual or that family. That's huge. And those who in this industry have been in the turn and burn game, who think that the employees are a little more fungible and it doesn't matter. If you're losing 2 and bringing 2 back in, you still have 2 employees, are kind of learning the hard way in the post-COVID world that that's not going to fly, even in this industry going forward. And so you're starting to see those cultural changes. And that's where I think we play roles in association. We've been laser focused and we're at the end game of building our own education and training institute that can provide this value for everyone in the industry. We talked about creating a ladder that people realize that this doesn't just have to be your first job, that there's a meaningful career with pretty good pay and benefits if you can follow, and creating certifications to go with that, but also educating the operators on how to create the kind of culture that's going to actually keep people is almost the central tenet, the primary focus of what we're doing. We're still into advocacy. Don't get me wrong. It is what we do, but education and training has become such a central piece of who we are and what we do. And it's fundamental going forward. So you'll see a lot more from us in the future on that.
Thanks, Justin. And David, how about in manufacturing? How are you attracting and retaining talent these days?
We have been very proud to be partners with the governor as she has rolled out her Michigan Reconnect program, her Futures for Frontliners program. We've been big fans of the Going Pro Talent Fund from the get-go of that, and we recognize that in training current employees, but also training the ones that we can recruit, the ones that we bring in the door right away. These programs are something that benefits not just the employee, but once we improve the employee, then it benefits the employer as well. supporting this program so that so our employees can expand their knowledge base, leads in turn to expanding their horizons. And I think that that's something that really good leaders strive to do on a daily basis. And we have to keep in mind that business owners are leaders. While we might have some bitterness, some bittersweetness that, all right, if I improve employee A, they may go out and start their own business, or they may go out somewhere else. That's okay. Because as they go out somewhere else, if they start their own business, whatever, they're improving the entire community, and we're a part of that community. So it's really kind of our job as leaders to promote the possibilities within our own people. How's that for alliteration? The other thing that manufacturers have been doing is reminding policymakers that, and this is something that we've kind of forgotten along the way in the height of our success, that there's more than one pathway to a good career. Not everybody's cut out for the 4-year university. Not everybody's cut out for the trades, but we've got to provide the K through 12 students those opportunities to find out what interests them. Because if somebody gets interested in a career, they get fired up. They get excited about that. And if that means someone's excited about being a nurse, fantastic. My daughter's in a CTE program. My daughter's a junior in high school. She's in a CTE program learning about nursing as we speak. At least she better be. Otherwise, I'm going to get a call from the school here in a little bit. But the important thing is that Christiana is finding out, is nursing something she's intrigued by? There's somebody else who might be intrigued by welding. Somebody else that might be intrigued by engineering. Somebody might be intrigued by entrepreneurship. Good leaders should not be afraid to provide those opportunities for their employees, and that's how you retrain, that's how you retain, that's how you recruit, and that's how you really kind of move the entire community forward.
Well, David, I'm glad you brought up Michigan Reconnect. I think it's an awesome program, and it ties into what the work that you all do at Michigan Works. For those of you who are watching us today, I want to give you a small example. And Nancy, this one happens to relate to a healthcare organization in Oakland County who was having trouble, not unlike a lot of others, getting people that do instrument sterilization. They had a huge shortage of people that could do this. And Jennifer Llewellyn, I'm going to give her a shout out because she runs our Oakland County Michigan Works, heard that, went to our community college, Oakland Community College, and said, hey, can you train people in how to do this? And they said, sure, we can. And between their partnership and the tuition that they were able to get from the Michigan Reconnect program, we were able to offer talented, trained people and help facilitate that. And that's just one example of, I think, the benefit of a Michigan Works office and the workforce development work that you all do on a daily basis to help make a real lasting impression on this issue. So I appreciate you bringing that up. I had a follow-up question, but I'm not sure how much it applies to your three industries, because my stereotype in my head is that there's not a lot of jobs that you can also do from home. But there's a huge dynamic now of people that we talk about work-life balance. They want to be home more, they want to work from home more, or they want more time off. And yet all three of your industries are pretty, intensive in terms of, being there for the patient, for the client, for the customer. Has that been an issue? Are there opportunities even in your fields where you can provide greater flexibility in terms of work at home or shift changes and the like? And Justin, maybe I'll start with you because it seems hardest in your field to me. But
Dave, I think you're right. It's kind of hard to do restaurant service or hotel service from remotely from home. Although they're finding ways to do it efficiently with less employees, which we can talk about the macro effects of that.
Yeah.
But I will say that this change in culture and how we think about it and how we conduct work overall, especially office work, is having a tremendous impact on this industry, right? Business travel was thought to come back by 2022, third quarter, to where it was in 2019. Now they're pushing that off to 2024 and maybe not ever, right? If Zoom is so efficient and we can cut down our budget by half on business travel, maybe we don't need to send people that's going to impact a certain segment of the hotel industry tremendously. If we do less conventions, that's going to impact especially downtown type areas and the suburban collection showplace, let's say in Oakland County, tremendously as well, if we're seeing less of that occur. And if you're restaurants who cater to lunch service, like we talked about in downtown Lansing here, you're feeling that acutely when there are less people working in offices who need to gather for meetings or just get food for lunch while you're in the office. That's impacting certain areas and segments tremendously. It's a near ghost town down here in downtown Lansing these days.
Oops. Yeah, good point. We were chatting about that earlier, but that's a great additional perspective to that. David, you want to jump in here?
Sure. And it's always good to follow Justin because he reminds me how hungry I am when I skip breakfast this morning. So I'm looking out for your members, man. But, let me tell the story of a company in Kalamazoo, a place called CalSec. I had a chance to do a tour with them a couple weeks back and was pleasantly surprised that aside from pay, they fully recognize that in order to help their employees achieve that work-family balance, that they have a role to play. Part of that role is they provide childcare for their employees. They've got their own version of a child development center there on their campus. So an employee can come in if they work in a couple days a week. If they're not remotely, they can bring their children with them. Children will have actually lesson plans that they'll go through. It's almost like not necessarily like just regular daycare, but it's almost like a development center as well. They're also helping provide tuition assistance for those employees who are looking to get back into school or get a higher degree or what have you. For those who are single, but still taking care of some furry children, they actually have an on-site pet daycare center that they provide their employees. But these things sound kind of lighthearted, but at the end of the day, it really has a positive impact on the morale of those employees and provides them that flexibility to be able to come into the office if they need to, or provide kind of a backup for any remote operations that they provide their employees on top of whatever the marketplace is requiring for pay rate. These are some of the things that manufacturers are learning about, are trying to implement in our workplaces as well. Yeah, when you've got 3 shifts working 24 hours a day, when the supply chain is there to support them, providing these ancillary type of things can help make sure that you're not burning those folks out, whether it's a second shift, third shift, whatever the case might be. Providing these things, I think we are discovering are part of the changes that employees are expecting from employers as we come out of the backside of this pandemic.
Thanks, David. And so, Nancy, same question to you. It's you got to be at work in a lot of cases, but how has this issue impacted healthcare? How has it changed? And what are you seeing there?
You're right. A lot of our employees do actually have to be physically present in order to provide patient care. But we've made the transition to remote work successfully in some of the internal operations of our hospitals. So the IT departments, for instance, human resources, administration, some of the claims processing. So we've learned to be more flexible and adaptable and allow that work to be done from home, which has been much more successful than we had anticipated that it would be. It really forced all of us to jump into something we knew was coming down the line anyway. And this just provided the impetus to do it literally overnight. For those people who do have to be physically present for these jobs, we've tried to, again, make sure that their schedules are more predictable. We've tried to cut down on the number of people who will call in sick with no notice because of the emotional burden that they're carrying, or because they're forced to quarantine, or they have a child or a family member who has been exposed. That creates downline problems for their colleagues as well. So we're paying really close attention to scheduling to make sure that we don't increase the amount of burnout for our employees. So I think the amount of work that can be done remotely We'll continue to be as flexible with those employees as we can. But at the same time, if we have caregivers that are expected to be in our hospitals on a day-to-day basis, I don't want to deprive them of having a human resources professional on staff who can work with them on benefit questions and mental health counseling and other support services that they need. So we've had to work on those flexible schedules for people who can do some work remotely, but we still want there to be a presence in the office to help support other people at the same time.
Yeah, great point. Thank you. And we haven't talked a lot about childcare, but I think that's a thread that is probably in all three of your industries as well. We got to do more. We knew that at the beginning of this year, only 60% of the childcare facilities in my county were operating because they have the same labor issues as everyone else. And so giving parents that opportunity is going to be critical to all this as well. Maybe I talked in the very beginning about why people were leaving. I want to ask maybe a more macro question, and maybe it's more anecdotal. I don't know if you have data around this, but for the people that work for your members that leave the workforce, where are they going? What have you heard in terms of either the kinds of industries they go to, or is it home, or is it, help us, a lot of folks that are watching this panel working in workforce development and are trying to look at these trends. Where are you seeing the people in the industries that you represent going? And of course, obviously, then that relates to how do you attract them or how do you get them back, I suppose. But David, let's start with you. Do you have a sense of that, where folks go if they leave the manufacturing workforce?
Those that are leaving, just from conversations that I've been having with many of our members, they go to places like Arizona or California or Hawaii because they're retiring. There's a good third of manufacturer employees who are in the later days of their careers, and so that makes it tough to try to recruit them or to try to retain them when you're at that. So that really kind of focuses our efforts to prime the other side of the pump, to really try to make sure that we're developing more people who are interested in manufacturing. So working closely with K through 12 policymakers, teachers, CTE directors to try to develop that. The other kind of chunk of people who are leaving jobs are not necessarily leaving manufacturing. And here's where we kind of break this into two groups. The larger of the two groups are those who are going to other manufacturers. This is just, all right, I've got a chance to either get a better flexible schedule, some better benefits, better pay over at this manufacturer. So that's where I'm going. I've been able to get a credential that allows me to move forward into another position. So that's kind of my kind of the pathway there. The smaller group are folks who are starting their own businesses. Even in this challenging pandemic time, you still have folks who are very interested in being entrepreneurs, and if they feel they have developed the skills, they feel they have developed the skills within them to make the most of the opportunity. There is a subset of folks who are willing to step up to the plate and they want to swing and try to hit that ball and get into the business and start their own companies. And that's really kind of refreshing to see. As frustrating as it can be to say, okay, we need to get help here, we need to fill all these spots. To see that there are people who are willing to, hey, you know what? I've got an idea for an electric battery, or I've got an idea. We know that electric vehicles are going to be a thing in the future. Maybe I've got an idea. I can push that. It's good to see that there are folks who are willing to try to take that. Again, it's a small subset, but that's where some of our folks are headed.
Yeah, that's a great point. Entrepreneurship is alive and well. Some of them, somebody in the notes said, TikTok influencers, man, there's a lot of opportunities out there for you if you're creative. One of the things you said, though, reminded me when you talked about the folks that, kind of went to Hawaii. The Detroit Regional Chamber just did a survey where they said that about 4% of the employees that have left have simply retired, left the workforce early, and to not underestimate what a 4% reduction in the workforce looks like. There's a disruption to that, and so that alone is having an impact. Nancy, I got to believe there's some folks in the healthcare field that have done that. Where are you seeing, either with data or anecdotally, you're hearing folks going that are leaving the workforce?
A large number of our nurses who are leaving are retiring. We had anticipated a workforce shortage of nursing and were planning on that, just didn't expect the pandemic to occur, which accelerated all of that, because nurses tend to be in an age bubble between their late 40s to their late 50s. And so this has caused a lot of them to reevaluate what they want to do with the remainder of their careers. We're losing some hospital caregivers to private physician offices where there isn't as much shift work as there is in a hospital. And we're losing a significant number of people to healthcare administration or insurance companies where, again, there are more office hours than 24/7 provision of care. So we're going to have a long-term pipeline problem in replacing these extraordinarily well-skilled nurses and physicians. And that's going to take some time for us to rebuild. But it does, it comes back to us as employers to develop the sort of workplace where people understand that they're appreciated. We show them that they're appreciated, and we demonstrate the value that they bring to our organizations. So it's something I think we can address and we have an obligation to address, but unfortunately it's not something that we can do overnight. I mean, this is going to be several years in the making to fill this gap. We are using a lot of nurses in Michigan who come here from Canada and a lot of foreign nurses as well, having some problems with the language proficiency sections of their tests. But at a certain point in time, we're going to have to decide, whether language proficiency is as important as the caregiving proficiency. And, where do we come down on some of those arguments about, we can't let perfect be the enemy of good when we're trying to take care of people in as expeditious a manner as possible. So, again, largely retirements, relocations to be closer to family, people who had thought that they were going to retire in 3, 4, or 5 years just said, I've had enough. That's the biggest challenge we have right now.
Thank you. Makes sense. So Justin, again, this might just be my own stereotype, but I'm guessing that a lot of the employees of your members are younger and maybe not retiring as much as you would find among nurses or others. Is that the case? And if so, what are they doing?
Yeah, this industry skews younger than pretty much any other industry out there. We're losing ours mostly to healthcare and manufacturing. No. In all honesty, to some degree that's true. Honestly, Amazon has been the greatest recipient. I alienated Dave Coulter. He's gone. To some degree that is Amazon has been the greatest recipient of loss from this industry. It's certainly not Hawaii for our members. There's only a few states that have lost a greater percentage of their hospitality workforce than Michigan, and Hawaii is certainly one of them. An economy that is 100% dependent on their travel and tourism industry, and so there's a struggle. There's a struggle there. Which one of you guys want to be the lead now? Nancy, do you want to take over?
Well, I've got 1108. Hey, there's Marty.
I'm still here, so I've just kind of removed myself from the video and audio. I don't know where Dave went. So that has not happened. Maybe address some questions that are in the chat.
Sure, happy to.
Would we like to do that? I know I saw a question here that mentioned if anyone's considered all of the individuals that passed away from COVID and how that's affected the workforce. Does anyone want to talk about that?
Yeah, I think that's a fundamental reason that this industry has struggled as well, right? Just that general sense of fear to be out there, either as a consumer dining or as someone working in the industry, dealing with people in person all day long, every day. It's not affecting everyone in the industry, especially because this industry does skew younger and they seem to be less risk averse and less impacted, I guess, in terms of health outcomes. But there's a segment of the population and of the workforce that sees those numbers, is terrified by those numbers, and that is causing negative impacts on both consumer and the employee side.
Mm-hmm.
Yeah, I'll back that up as well. I think manufacturing was fortunate that early on in the pandemic, we were able to find what the best practices were for social distancing and how to try to keep our people as safe as possible. We had a lot of folks who were willing to invest money into new HVAC systems and safety systems to try to prevent the spread. And now that the vaccine is here, we're still able to try to address pretty arguably effectively how that concern can be managed, but it's still there. You still have folks who are fearful of bringing COVID from the workplace to the home, and vice versa. Actually, you have some folks who are afraid that their child under 12 going back to school might catch it, bring it in the home, and then do they bring it to their good friend that they're working next to on the factory floor? And so that causes some concern there. But again, we were fortunate to try to get a lot of those best practices in social distancing and try to cut down on that spread as much as we could early on.
Well, thank you for addressing that. Hi, Dave. You're back, so that's wonderful.
Technology is a beautiful thing until it isn't.
Yeah.
I apologize.
No, that's all right. There is another question from the chat that, though, I think is a really great one. And someone said, how do we develop better leadership and managers so employees want to stay in their positions? And I think that's a great question. Can all of you talk about that?
I kind of touched upon this earlier. Again, we're very big believers in the Going Pro Talent Fund and providing training and improving our employees. And in doing so, that kind of provides some pride, some ownership in for that employee within the institution. But at the same time, I don't think it is necessarily something we should be afraid of. If we have developed a really good employee and they then want to step out on their own, that benefits the entire community. And in turn, that gives us another opportunity to then bring somebody in. And I think strong leaders, good leaders, and somebody in the chat, said, how do you define a good leader? I think good leaders should not be afraid of those opportunities where an employee betters themselves, leaves, gives us an opportunity to bring somebody new in to better themselves so that either they stay or they leave, and then can kind of continue that. It can be frustrating, can be bittersweet, because you've invested some time and energy into developing that employee. But if we're being good corporate citizens, that sometimes that byline comes around, we want to be good corporate citizens, then you shouldn't be afraid of that. Good leaders look to develop those they are leading.
So David, great point. We have like 2 minutes left. So I'm sorry, Justin and Nancy, if you could just give us your 1 minute answer on leadership and developing the kinds of leaders that your organization needs to be successful.
Nancy, you can go.
Thanks. One thing I've been impressed with in our hospitals over the last 18 months is that the leadership that has been demonstrated by simply showing up. Hospital executives who generally don't provide direct patient care, some of them do, some of his physicians or nurses, but they're actually there shoulder by shoulder with the people in the hospital, sharing the same sorts of burdens and trying to understand what it's like to be working on the front line. I don't think you can do that at Absentia. You can't sit in your office and tell your employees you're concerned about them if you're not willing to walk right by their side every day and see what they experience. Great point. And Justin, I'm pretty sure you'd agree with that. Anything that you would add?
The thing I'd add is this industry is where people get their first opportunity more than anyone else. So our ability to instill what people need for their second, third, and fourth job is incumbent on that manager and that leader and that team being able to have all the skill sets they need to impart that so our next generation can do what they need to do. And that's part of what we're doing at the Training Institute in Michigan as well. So that's our focus.
Awesome. Well, listen, I just want to thank our panelists for their time, sharing such great knowledge and thoughts with us today. I found this whole session engaging and informative. I hope the folks that were watching us did as well. So thank you all so much for taking time. I hope the rest of you enjoy the conference. And don't forget, as Marty said, if you're a participant, go to the exhibitor networking break session that starts now. Thank you, everybody, so much for being here with me today.
Thanks, Dave. Thanks, Nancy. Thanks, Justin. Go Broncos.